Hi, my name is Kylie Heyerdahl, and I chose to focus my topic on depression, which is something that I've personally experienced and something that I've seen my mom and my best friend go through. So, I kind of want to start off with just explaining what depression actually is. From my own experience, I've noticed that in everyday conversations, people will be like, oh my gosh, I'm so depressed. When it really just means that they're sad about something that happened during that day. And I really used to not think much about it, but over time, I come to realize that depression is a lot more than that. It's not just a short term feeling, it's a persistent feeling that can affect how somebody thinks, feels, and just functions in their everyday life. And something that I didn't fully realize before is that depression comes from a mix of different factors. It's not just one thing. It can be genetic, psychological, or environmental. For example, somebody might be more at risk of depression because of family history, while someone else might develop it because of stress, trauma, grief, even certain personality traits. Even their nutrition can play a role, or the medication they're taking, or using substances. It really just kind of depends on the person, but a lot of different things can really play a role in depression and where it comes from. And when it comes to symptoms, depression can show up in a lot of different ways. Some of the most common ones are feelings of sadness or feeling empty most of the time. You have really low energy. You have changes in your sleep patterns. You might sleep too much. You might sleep too little. You lose interest in things that you used to enjoy. Your appetite changes. Maybe you're eating too much, or maybe you're eating too little. Maybe you have trouble focusing. And in more serious cases, you get a lot of feelings of hopelessness or even thoughts of suicide, which is something that really needs to be taken more seriously. And there are also ways that you can treat depression, though. There's different types of therapy. There's cognitive therapy, there's behavioral therapy, there's cognitive behavioral therapy, there's interpersonal therapy, there's supportive therapy, there's mindfulness-based cognitive therapy. There's so many different kinds of therapy, and each one kind of focuses on different parts of depression, whether that's your thoughts, behaviors, emotions, relationships. Medication is also a very common type of treatment for depression, especially antidepressants. And when it comes to medication, there are a lot of things that need to be discussed with patients, like the side effects, what can happen if it's mixed with other medications, things like your health history to make sure that the medication that you are taking is actually safe for you. And something that really stood out to me is finding what works for you can take time. It's not always immediate, and people may have to try a few different options before they find out what actually works for them. And now, on a more personal level, why this topic is so important to me. Growing up, my mom always did struggle with depression, and at the time, I didn't really understand why she felt the way she did. Why was she sad all the time? Why couldn't she be happy? I didn't really get it. It honestly wasn't until I came to college and I started noticing a lot of the same feelings that she had within myself. I lost interest in doing a lot of things I used to enjoy. I slept all the time. I barely ate any food. I'd spend hours and hours watching TV or just scrolling through TikTok without any motivation to do anything else. And I just honestly felt like I wasn't good enough no matter what I did. Eventually, I did try cognitive therapy, which is supposed to help you change your negative thoughts into more positive ones. But for me, it wasn't just enough on its own. So after doing therapy for a little while, I decided to go see a psychiatrist, and I was prescribed the medication Lexapro. Since starting medication, I've honestly noticed such a big difference within myself. I have a lot more energy, my mood has improved a lot, and of course I still have hard days sometimes, but I've honestly just felt like a lot more myself ever since starting it, and I'm actually starting to enjoy a lot more of the things in my life. So overall, this topic does really matter to me. not just because of my own experience, but because I know so many other people that can relate to it as well. And in the future, as a therapist, I want to understand depression better so I can help people feel less alone in their struggles and feel less alone in what they're going through. Thanks.